My name is Carrie Barlow. I'm a physical therapist and I work here at Franciscan Hospital for Children in Boston. I've been here 15 years, but the pool is going on its 9th year that we've had it. And we're a pediatric facility that works with kids with special medical needs, so we have a really wide variety of children and patients that we see in the pool. There's a variety of different programs that are here at Franciscan Hospital for Children. We're primarily a rehab hospital, which means that if a child had an injury, they may get treated and survive at an acute hospital like Children's or Mass General, but they would come here for their rehab needs. We also have a pulmonary program for NICU preemies, which is a fabulous program, but those children never go in the pool. We have a school that's associated with the hospital. It's called the Kennedy Day School, and it's a school that kids, get on the little bus from home in the morning and drive to our school, and then go home again at the end of the day. But they're all children with significant physical, intellectual, and medical disabilities. So those kids will use the pool as part of their school physical therapy services. And finally, we have outpatients, and we have a real niche in the community for kids with disabilities who then need outpatient physical therapy services. And those are also kids who get to be in the pool. We knew we wanted a pool. We knew we wanted to add aquatic therapy to our services that we provide to the kids. But we realized really quickly that we just couldn't build a regular pool because that wouldn't service the many different children that we see here. And when we looked around at what was in the marketplace, HydroWorx was a perfect fit because especially at the floor that goes up and down and the treadmill and the jets, those features were just fit our kids perfectly. So I can have a 2-year-old in this pool and I can have a 6-foot 15-year-old in this pool and do exactly the kind of therapy that I want. So when you talk about kids getting in and out of the pool, there are some kids that you want the floor down low in the water because part of your therapy program is for the kid to get down on hands and knees, get on their belly, slide into the pool, and then it takes a fair amount of strength and coordination to get out of the pool. And again, that can be part of your physical therapy goal, is just using those muscles and strength to get in and out of the pool. There are other kids who don't have that ability, that maybe they've just had surgery and really can't get down on the floor yet. So for those kids, we might raise the floor all the way up, put the bars in place so the child has something to hold on to, and then we can just lower the child down into the water. For some of our other kids who use wheelchairs for mobility, we have a waterproof wheelchair that we've purchased. And so we can transfer the children from their wheelchair to this waterproof wheelchair, bring the floor all the way up, the waterproof wheelchair goes onto the floor of the pool goes down, the wheelchair ends up in the back corner of the pool, and then you can work with the kid. It makes it possible for us to get some of the really bigger kids into the water that otherwise it might be too difficult to do it and might take too much time, and you might not use the pool when it gets hard. Since this pool is easy, you're more likely to use it. Well, it's challenging because they're kids, so they have absolutely zero intention of exercising. But if we make an activity fun and playful, they'll do it. So we have the classic kinds of goals that any physical therapy program would have. So one goal might be for a child to be able to sit better on a chair or on a bench. So they might spend a therapy session sitting on a bench and shooting a water gun at some ducks. But what the therapist is looking at is how they're sitting, how they're using their tongue control. When their skills improve in the water, then we can start to work on those skills in land, and then it can be a skill that the child masters and is always able to do.